What if I told you your body whispers the signs of prostate cancer years before it becomes life-threatening? Most men miss them, and by the time they notice, it's too late. So what are those whispers? The first one often shows up in the bathroom. Maybe you're waking up more at night to urinate, or your flow feels weaker than before. Another warning can be a drop of blood in urine or semen. Even once, that's a sign you should never ignore. Some men suddenly struggle with erections, not realizing it can sometimes connect back to prostate changes. Others feel a dull ache in the hips, lower back, or pelvis that doesn't seem to go away. And perhaps the most silent signal is rising PSA levels, something you can only find through a simple blood test. Remember, these are not final verdicts, but early alerts. Listening to them and getting checked early can make all the difference for your long-term health. Hi, I'm Dr. Jen Gunter, a urologist with over 15 years of experience treating men with prostate and sexual health concerns. Over the years, I've seen the devastating impact of catching cancer too late, but I've also seen how powerful early detection can be. And that's why I'm here today, to help you recognize the warning signs before it's too late. In this video, I'll share the 5 early warning signs of prostate cancer that every man over 50 needs to know. I'll also explain how to tell the difference between harmless changes and the ones you should never ignore. And make sure you stay with me until sign number 5, because it's the one most men completely overlook. Before we dive in, do me a quick favor. Hit the subscribe button and turn on notifications so you don't miss any of these important health updates. And if you find this helpful, share it with a friend, a brother, or a loved one, because the right knowledge at the right time can truly save a life. Sign number 1, changes in urination. Frequent trips to the bathroom at night. Don't just blame aging. Sure, as men get older, the bladder and prostate naturally change. But when those trips to the bathroom become more frequent, when you notice the stream isn't as strong as it used to be, or you suddenly find yourself straining just to get started, that's not something to ignore. Let me tell you about one of my patients, David. He was in his early 60s, healthy, active, and thought he was just dealing with what every man deals with after 50, waking up 2 or 3 times a night to pee. He brushed it off for years. He joked with his buddies that he was just getting older. But when he finally came to see me, his tests showed something far more serious. It wasn't just benign prostate enlargement pressing on his bladder. There were cancerous cells interfering with the normal function of his urinary tract. And because he waited so long, his treatment was more complex than it needed to be. Now, I'm not telling you this to scare you. I'm telling you because this is exactly how so many men miss the whispers their body is giving them. You see, the prostate sits right below the bladder and wraps around the urethra, the tube that carries urine out of the body. When the prostate gets larger, whether from normal aging or from cancer, it can squeeze that tube and cause changes in urination. You might notice a weaker stream. You might stop and start mid-flow. You might feel like you haven't completely emptied your bladder, even right after going. And here's where it gets tricky. Not all urinary changes mean cancer. In fact, the majority of cases are due to benign prostate hyperplasia, also called BPH. But here's the catch: you can't tell the difference on your own. The symptoms can look identical. That's why assuming it's just age is so dangerous. Think of it this way: if your car engine starts making a strange noise, you don't just turn up the radio and pretend it isn't there. You get it checked. Why? Because a small fix now can prevent a major breakdown later. Your body works the same way. When your urination changes, that's your engine light coming on. So what should you do? The first step is awareness. Pay attention to new symptoms. If you've suddenly gone from sleeping through the night to waking up 3 times, that's a change worth noting. If the flow feels weaker or you're straining to get started, don't ignore it. And if you're leaking a little after you thought you were done, that's another signal. The second step is action. Talk to your doctor. A simple checkup, a PSA blood test, or a quick scan can tell us whether it's just an enlarged prostate or something that needs urgent attention. And remember, if it's caught early, prostate cancer is one of the most treatable cancers in men. Let me emphasize this. New, worsening, or persistent urinary changes are not something to brush off. Don't let embarrassment or fear stop you from getting evaluated. I've seen men who delayed for years, thinking it was nothing, only to regret not coming sooner. And I've seen men who came in right away, got an early diagnosis, and went on to live long, healthy lives. So if you've noticed changes in your urination, whether it's frequency, urgency, weak stream, or that nagging feeling that you haven't emptied completely, don't wait. get checked. It's not just about your bladder. It could be your prostate quietly asking for help. Sign number 2, blood in urine or semen. Even a single drop of blood is a red flag. Most men see it once and think, maybe it's just an infection, maybe it'll go away on its own. And sometimes, yes, blood can come from a minor infection or even a small kidney stone. But here's the truth. In men over 50, blood in urine or semen is never something to ignore. Let me share a story. A patient of mine, Michael, came in his late 50s. He had noticed a pinkish tint in his urine a few times, but he brushed it off. He told himself it must have been from exercising too hard at the gym. He didn't want to worry his wife, so he kept it a secret for months. By the time he came in, the bleeding had become more frequent, and the test showed something much more serious, prostate cancer, that had already started to spread. He told me, "Doctor, if only I had come in sooner." That's a sentence I never want to hear again, so let's talk about the science. Blood in urine, called hematuria, can come from several places in the urinary tract, the kidneys, bladder, or prostate. When prostate cancer develops, it can invade blood vessels in the gland or nearby tissues, releasing blood into urine or semen. Sometimes it's visible, bright red or pink, and sometimes it's microscopic, only picked up in a lab test. In semen, blood may show up as a brownish or rusty color. While not every case means cancer, it's a warning that something is wrong. Here's why this matters. The prostate sits in a delicate spot, right where the urinary and reproductive systems connect. Any disruption, whether from inflammation, infection, or cancer, can allow blood cells to leak into urine or semen. It's not normal. It's not something that happens just because you're older. Think of blood like the smoke from a fire. Sometimes it's a small fire easily put out. Sometimes it's a bigger one that's already spreading. Either way, when you see smoke, you don't ignore it, you check where it's coming from. So what should you do? First, don't panic, but don't delay. If you notice blood even once, it's worth getting evaluated. Your doctor may order a urine test, a PSA blood test, or imaging to rule out kidney or bladder issues. The important thing is not to wait for it to happen again before taking action. Second, remember that early action changes outcomes. I've had patients who came in after one episode of blood, and we found very early, very treatable prostate cancer. They had minor procedures, quick recoveries, and went on with their lives. On the other hand, I've also seen men who waited until the bleeding was obvious and persistent, and their treatments became far more aggressive. And finally, talk about it. Don't hide it from your spouse or keep it to yourself out of embarrassment. Blood is your body's alarm system, and alarms are meant to be heard. So to recap, if you ever notice blood in your urine or semen, even if it's just a trace, don't ignore it. Don't self-diagnose. Don't wait for it to go away. Get checked, because while blood can come from something minor, it can also be the earliest whisper of prostate cancer, and catching that whisper could save your life. Sign number 3, sudden erectile dysfunction. Your erections aren't just about the bedroom. They are a barometer of your overall health. Many men don't realize that trouble getting or keeping an erection can sometimes be one of the earliest signs of prostate cancer. Let me share a real case. A man named Robert in his early 60s came to see me after suddenly experiencing problems in the bedroom. He had always been healthy, never smoked, exercised regularly, but over just a few months, he noticed a big change. At first, he thought it was stress, maybe even fatigue from work, but when it continued, he knew something wasn't right. After running some tests, we discovered prostate cancer that was pressing on the nerves and blood vessels responsible for erections. Catching it early gave him a strong chance of recovery, but if he had waited longer, his outcome might have been very different. So why does this happen? The prostate is located in a sensitive area, surrounded by the nerves and blood vessels that control erections. When cancer grows in or around the prostate, it can directly affect those pathways. But that's not the only reason. Erectile dysfunction can also be linked to blood flow problems, heart disease, diabetes, or hormonal changes, all of which can overlap with prostate health. That's why sudden or persistent erectile dysfunction should never be dismissed as just aging. Here's the science in simple terms. Erections are like a performance test for your vascular system. You need healthy blood vessels, balanced hormones, functioning nerves, and a calm mind. If any one of those is disrupted, problems can appear. And when prostate cancer develops, it can silently interfere with both the nerves and the blood supply to the penis, showing up as ED before any other symptom. Think of it this way: if your car headlights suddenly start dimming, you don't just assume it's because the car is old. You check the wiring, the battery, the alternator, because dim lights could mean a much bigger issue under the hood. The same principle applies here. Sudden erectile problems are your body's warning light. So what should you do if you notice changes? Step 1, don't ignore it and don't let embarrassment stop you from talking about it. Step 2, talk to your doctor. A medical evaluation can help separate whether it's stress, circulation issues, or a deeper problem like prostate cancer. Step 3, take action early. Because if it is prostate cancer, detecting it at this stage can make treatment far easier and more effective. I always tell my patients, once in a while, every man may have a day where things don't go as planned in the bedroom. That's normal. But if it starts happening often or it changes suddenly, it's not something to shrug off. Your body is giving you important feedback. So to recap, sudden erectile dysfunction is not just a bedroom issue. It's a signal that something deeper could be happening, whether in your heart, your hormones, or your prostate. Pay attention, take it seriously, and get checked. Because the earlier we know the cause, the more options you have to protect your health, your confidence, and your future. Sign number 4, pain in the hips, back, or pelvis. A dull ache in your lower back might feel like arthritis, but sometimes it's much more serious. Let me tell you about James, a 67-year-old patient of mine. He came in complaining of a nagging ache in his lower back and hips. He thought it was just years of heavy lifting from his construction job. He tried over-the-counter pain medicine, massages, even physical therapy, but the pain never really went away. When we finally did a thorough exam and ran blood tests, we found prostate cancer that had already spread to his bones. If James had come in earlier, the treatment could have been simpler, but because he waited, the disease was more advanced and much harder to treat. So what's the science behind this? Prostate cancer has a tendency to spread or metastasize to bones, especially the spine, hips, and pelvis. When cancer cells travel from the prostate, they often settle in the bone tissue, creating pain that feels like stiffness, soreness, or even sciatica. Unlike muscle pain, this discomfort doesn't go away with stretching or rest. It can be constant, sometimes worse at night, and often slowly gets worse over time. Here's why this matters. Men often dismiss back or hip pain as just getting older. And yes, arthritis, disc problems, and daily wear and tear are common causes. But when pain is persistent, unexplained, and doesn't respond to usual care, it deserves closer attention. This is especially true if you also have urinary changes, blood in urine, or sudden erectile issues. Taken together, these signs can point strongly toward prostate cancer. Think of your bones like the foundation of a house. If cracks suddenly appear, you wouldn't just keep repainting over them. You'd check what's happening underneath. Because a weak foundation means the whole structure is at risk. The same is true for bone pain. It's the foundation of your health telling you something is wrong. So what should you do if you feel this type of pain? Step 1, don't ignore it if it lingers for weeks or months, especially if it gets worse at night or when resting. Step 2, get evaluated by your doctor. Imaging tests like X-rays, bone scans, or MRIs can reveal whether the pain is due to wear and tear or something more serious like cancer. Step 3, remember that early detection makes a huge difference. If cancer is found before it spreads widely, treatments are far more effective and less invasive. I often remind my patients, back pain is one of the most common complaints in medicine. But persistent, unexplained pain, especially in the hips, pelvis, or spine, is not normal. Don't chalk it up to age. Don't wait until it gets unbearable. So to recap, if you're over 50 and experiencing ongoing pain in your hips, back, or pelvis, don't just assume it's arthritis. It could be your body whispering one of the earliest signs of prostate cancer. And the sooner you listen, the sooner you can take action to protect your health and your future. Sign number 5, rising PSA levels, the silent signal most men ignore. Here's the truth, the most dangerous sign of prostate cancer is often the one you can't feel at all. Let me tell you about Mark, a 59-year-old patient who came to me for a routine checkup. He had no urinary issues, no pain, no trouble in the bedroom, nothing that would make him think something was wrong. But his PSA blood test came back higher than normal. We repeated the test a few weeks later and it was still elevated. After further evaluation, we discovered early-stage prostate cancer. Mark was shocked. He said, "Doctor, I felt perfectly fine. I never would have known." Because we caught it early, his treatment was straightforward, and today he's doing great. So what exactly is PSA? It stands for prostate-specific antigen, a protein made by the prostate gland. A small amount is always present in the blood, but when levels start to rise, it can be a sign that something abnormal is happening, like infection, benign enlargement, or prostate cancer. The challenge is you won't feel a rising PSA. It doesn't cause pain or visible symptoms. That's why it's called the silent signal. Here's the science. Prostate cancer often grows slowly and silently. While some men develop obvious symptoms like changes in urination, blood in urine, or pain, many don't notice anything until the cancer is advanced. PSA testing gives us a window into what's happening before symptoms appear. It's like checking the oil in your car. You don't wait for the engine to break down before lifting the hood. Now, some men worry because PSA isn't perfect. It can be elevated for reasons other than cancer, and not every prostate cancer needs aggressive treatment. But here's the key. The trend matters. A single elevated PSA might not mean much, but a steadily rising PSA over time is a red flag that we cannot ignore. Think of PSA like the smoke detector in your house. Sometimes it goes off because of burnt toast, no big deal. But other times it's because of a real fire. You don't ignore the alarm just because it might be nothing. You check it. The same goes for PSA. So what should you do? Step 1, if you're a man over 50 or younger, if you have a family history of prostate cancer, talk to your doctor about PSA testing. Step 2, don't panic if your number is a little high. It's just one piece of the puzzle. Your doctor may repeat the test, check the velocity of change, or recommend imaging or a biopsy if needed. Step 3, stay consistent with your screenings. One test is useful, but tracking the trend over time is what really saves lives. I always tell my patients, the biggest mistake is not getting tested at all. Prostate cancer caught early through a rising PSA is often treated successfully, with far fewer complications. But if you wait until symptoms show up, the options become more limited. So to recap, rising PSA levels are the silent whisper most men miss. You can't feel it, you can't see it, but it could be the difference between catching prostate cancer early or fighting it too late. Don't ignore the silent signal. Ask about PSA, track it over time, and use it as a powerful tool to protect your future health. So remember, changes in urination, blood in urine or semen, sudden erectile problems, ongoing bone or pelvic pain, and rising PSA levels, these are not random inconveniences. They are whispers from your body, early signals that something may be wrong. Don't ignore them. Early detection is often the difference between a quick, manageable procedure and a life-threatening battle. And here's the most important thing. These signs do not make you weak. They don't take away your strength or your masculinity. They make you aware, and awareness is what saves lives. When you pay attention to these signals and take action early, you give yourself and your loved ones the best chance at a long, healthy future. So listen to your body, talk to your doctor, and remember, knowledge is power, and your health is worth protecting. If you found this video helpful, hit the subscribe button right now. Only a small percentage of you watching are actually subscribed, and I don't want you to miss out on future videos that could truly make a difference for your health. I share practical, life-saving information here every week, and subscribing is the easiest way to stay updated. Also, do me a favor, share this with someone you care about, a brother, a father, a close friend, because you never know whose life you might save just by passing along the right knowledge at the right time. Remember, awareness is powerful, and together we can help more men recognize the early signs, take action, and protect their health for years to come. So subscribe, share, and let's keep spreading this important message.